the world of drugs. Yes, I want to give the floor to Mrs. Alison Ritter, University of New South Wales. Crisis and COVID-19.
To be here with us. We really appreciate it. I welcome you to this space and please go ahead. The floor is yours.
Thank you very much. Welcome everyone around the world. Thank you for joining us for this important session on drug supply. I'm in Sydney, Australia. It is 5 a.m. in the morning. I know it is different times all around the world. So thank you very much wherever you are and whatever time it is where you are today. Drug trafficking is a serious criminal activity. It consumes a lot of policing resources, and I'm delighted to have speakers here today to talk about their work trying to understand drug trafficking in the context of COVID. We will hear from the speakers first, and then we will take many questions and discussion about how we can both improve our statistics and our monitoring of drug trafficking as a serious crime, but also what we can learn from the COVID experience in terms of the disruptions to drug supply and the re-establishment of drug supply during COVID. Our first presenter is Tim Surmont, who comes to us from the European Monitoring Centre on Drugs and Drug Addiction. Tim has long experience monitoring drug supply trends, and I'm delighted that he's agreed to be with us today. Can I please hand over to Tim for the first presentation? Thank you, Tim.
Thank you very much, Alison, for this nice introduction. Good morning, good afternoon, and good evening, everyone. I will start sharing my screen and get immediately to my presentation. All right. Let me see. So I hope it's well visible for everyone. Right, I'm going to talk to you in the next 10 minutes about COVID-19 impact on drug production and drug trafficking in the EU. First, just one little slide about our agency, the EU Drugs Agency, or EMCDDA. We are a decentralized EU agency established in 1993 and operational in Lisbon since 1995. We are considered the EU reference point on drugs with a mandate to provide factual, objective, reliable, and comparable information on drugs and drugs addiction. We also have an operational component being responsible together with Europol for the EU early warning system on new psychoactive substances. We have quite a broad mandate. While we were initially established as a health agency, this has evolved over the years to two components like health and security divided equally. COVID-19 and EU drugs markets, we have done two rapid assessments, one early in 2020 and one early 2021 with our member states, with intelligence data from Europol and other law enforcement experts. And the results of that I will present to you now. These publications that you see here are free to download on our website. We'll start with cannabis, especially because it's the most used drug, listed drug in the EU for the moment. And I will first start with herbal cannabis. As all EU member states have reported domestic cannabis cultivation, there was not as such a lot of disruption of the production because it was all within the territories. Even in some countries, it was reported there was some increase in growing cannabis for personal use. And this had possibly also to do with what happened after the first wave or during the first wave of COVID-19. There were shortages at the retail level, which was probably the result of users stockpiling herbal cannabis to at least be settled for a longer period. And this also resulted in some higher prices. What happened is, especially on retail level, we saw an increase in online sales and distribution, not only through darknet, but also on the surface web and social media. Also on the retail level, we saw an adaptation of retail sellers. There was more home delivery, and there was more use of post parcels. Early 2021, when some countries had already reopened certain parts, you see again that there were some bulk seizures of herbal cannabis reported, more or less like the pre-COVID periods. So the next one is cannabis resin. Interesting to know about this. If you look at the map, you should focus on the yellow-orange arrows of trafficking lines of cannabis resin. The green ones are herbal, from our last EU drug markets report. It's interesting to know that in Morocco, which is a main global producer of cannabis resin, and also, of course, #1 supplier of the EU market of cannabis resin, there were quite some intensified law enforcement actions from Moroccan authorities, as well as Spanish authorities on hashish trafficking. And this resulted in some drafts already in Northern Europe, basically just before the first COVID wave kicked in. What we see then during the COVID-19 wave, this led to closed borders, especially the first cross here below, the closing of boat traffic in the Strait of Gibraltar, so no ferries with lorries, and also the closure of the Spanish-French border made traffickers shift from land trafficking to commercial maritime container flights, indicated by these two bigger yellow arrows. And this was confirmed by some extraordinary large bulk seizures of hash, of cannabis resin in, for instance, Brussels, in Antwerp, and also in the Netherlands, in maritime ports, which is rather unusual. I'm not going to discuss retail disruption because it's more or less the same idea as it was for herbal cannabis. Over to cocaine. Multi-ton record seizures in European ports in 2020 and 21 indicate that there was no significant impact on transatlantic maritime trafficking of cocaine. On the other hand, trafficking via human couriers almost reduced to nothing in 2020 due to air restrictions. We noticed through our experts there was an increase in price and decrease in purity at retail levels, which at least might indicate some supply issues. Just like it was the case for cannabis, we saw an increased distribution of cocaine through darknet and through online. And also important to note, in 2020, we saw an increase of cocaine extraction labs discovered in the Netherlands, which indicates that besides the normal cocaine trafficking, there's also cocaine base being now trafficked towards Europe since the COVID era. In terms of trafficking in the EU to the EU, everything more or less stayed the same, but based on data from the port of Antwerp, which is the main entrance of cocaine in Europe, we see quite some changes from the origin. So in Latin America, there were some changes, probably related to COVID. Of course, we can never be 100% certain, but it's nice to compare the 2019 seizures of Colombia, which are, if you see the yellow bar, usually within legitimate goods, and were the most frequent origin of cocaine entering the port of Antwerp. And you see in 2020, over the same period, this has reduced substantially. And you see a large increase of Ecuador being now the main country of origin, as well as other countries in Latin America who in 2019 were out of the picture are now being the origin country of shipment of maritime cocaine coming into Antwerp. Over to heroin. We have no indications on poppy cultivation that there was an impact. Of course, this is in Afghanistan. We of course have to rely on a network of European experts. So I'm sure UNODC has much more to tell about this than I do. What we did notice is that there was a continued intensified use of commercial goods transport for trafficking over land through the three arms of the Balkan route. On the other hand, we saw some large port seizures of heroin, again in Northern European maritime ports, which indicates at least more use of maritime freights as well to move bulk heroin. Further, we just noticed that there was a decrease in air trafficking, just as it was the case for cocaine, especially via the southern route. And because of the specifics of the retail market of heroin, it was also not easy to find some impacts on that. Going over to amphetamine and MDMA, of course, COVID has led to the closure of recreational settings that are typically connected to the use of MDMA or ecstasy and amphetamine. So demand dropped severely. Main global producer, the Netherlands, had reported that orders were still ongoing. So there must have been demand somewhere in the world, but in Europe it had gone down at least substantially. According to Dutch and Belgian police, however, they said that to them, it's just business as usual. The production was not getting any setbacks. Even in 2020, the Netherlands and Belgium saw an increase in labs being discovered, but a decrease in dumpings. It's a bit weird. You could say it's a bit weird that they have increased labs being dismantled and a decrease in production waste that's being found. So where is it all going? Possibly because people had to stay inside, the dumpings are less noticed, or because everyone had to stay inside, even the criminals were more stockpiling the production waste and keeping it for a later period to dump. Methamphetamine has traditionally been something that was produced in small-scale labs in the Czech Republic. But what we have seen since 2020 is an increase of large-scale labs of methamphetamine in the Netherlands and Belgium. It was often connected to involvement of Dutch and Mexican criminals, and other South American nationals were also often found in the labs. This is a concerning trend, especially because methamphetamine market in the EU, the user market is rather low. So we can almost say with certainty that most of it is going outside of the EU, but it's being produced now on a larger scale in Netherlands and Belgium with involvement of Mexican cartels. Especially as you can see in 2020, the Dutch police discovered 32 labs, which is more than 3 times of the year before. On the other hand, a possible explanation for this and also for amphetamine and MDMA labs can be that there was a possible impact of the law enforcement operations targeting encrypted communication devices of criminals, which has led to some substantial arrests. And this may have led also to an increased detection rate of the laboratories. So I'm going to summarize in short. of what I have said, it's a resilient drug market. There is adaptation to travel restrictions and border closures. We see more smuggling via intermodal containers and commercial supply chains. There's a diversification of drug trafficking routes, more heroin and more cannabis resin overseas. No decline in supply is evident. Multi-ton seizures of cocaine in European ports in 2020 and early 21 confirm this. On the other hand, we see, especially at the retail level, that there's a more digitally enabled drug market. Technology is increasingly being used to sell drugs, and it's probably here to stay. More people are getting acquainted with ordering online, and this might lead to a substantial shift in how retail markets operate. So I think I stayed within my 10 minutes, more or less. I thank you for attention, and I give the floor back to the chair. Thank you.
Thank you very much, Tim. Just stay exactly where you are, because I have a couple of questions. Firstly, I was wondering if you could comment briefly on the methods that you use to collect all of these data.
Yes, so the method used is a EMCDDA transporter methodology, which is a rapid assessment. What we do is we construct online surveys, and we have a network of experts. Like for this information, it's law enforcement experts over the member states. We send them the survey, which is very detailed. They fill it in. Each member state also has a focal point, a national focal point that collects data, and they get the survey as well. And then when we have collected the data of the survey, we do focus groups with different law enforcement experts, where we see that there are some interesting changes based on the surveys. And then on top of that, we of course scan through open source information, any relevant press releases on recent seizures as well. And we do this in a matter of 1 month time. And then we have a transporter report. Mm-hmm. So this is, and we did it 2 times. We did it in 2020 in March, and not March, in May, and the same in May 21.
Thank you. So it's a combination of expert opinion, focus groups, law enforcement data.
Exactly, yes.
And then public sources, yeah?
Yes, exactly.
Okay, good. My second question is in relation to the internet and digital technologies.
Yes.
You mentioned the rise of these, which we have seen globally, not just in the crime and trafficking area, but also in healthcare and service delivery and so on. What proportion of the market of drug selling is taken up by the internet-based? I mean, obviously this is an approximate, but I guess my understanding is that it is still a very, very small proportion of the retail sales.
Yes.
I don't know about the wholesale. Do you have a view?
I'm not so sure about wholesale, but at retail level, it's approximately, especially during COVID, I think between 5 and 10%. I have no idea on wholesale trafficking. We saw more advertisement because we can do darknet scraps. Which was also an input for one of the 2 reports. But I guess that's more or less the percentage.
Yeah, I do think it's very interesting that we talk about the rise of technology, but at the retail level, we're still only talking about around 10% of retail sales of illicit drugs, and we don't have a good idea about the wholesale sort of large-scale trafficking, but we suspect that it's probably not that big. But it's like digital technology, the world's changing. Actually, drug markets, not, I mean, it's getting bigger, but it's nowhere near what people might think if they didn't work in our area.
Yeah, true. And it's also not for every drug. Traditionally, I don't see heroin addicts logging into social media to order a shot. It's very specific. It's very specific.
That's true. Thank you so much, Tim. That's very much appreciated. We're now going to move. So Tim's given us the European perspective. We're now going to go to the global perspective. And I'm delighted to welcome Dr. Irmgard Zeiler from the United Nations Office of Drugs and Crime. And Irmgard's going to be talking to us about drug supply chains, impacts and outlooks. Thank you very much, Irmgard.
Thank you, Alison. I hope you can see my screen. Can you see the presentation?
Not quite yet, no.
No, that's not good. I'm having...
That's okay. Take your time, Irmgard. Yes, we can now see the screen. Wonderful. And it looks like it's working very well.
Thank you very much. Let's see. Yes. Okay. So indeed, yes, we are. I'm going to talk about the impact of COVID on drug markets from a global perspective. And we started the research by thinking of how COVID-19 affected global drug markets or had the potential to affect them, what the mechanisms were that the pandemic could disrupt or change or transform drug markets at the global level, starting from production to trafficking to use, including service delivery, even though here I'm going to focus on the drug trafficking aspects. So as we all know, there were very strict mobility restrictions and increased border controls throughout the pandemic, and in particular in the first in the initial stages. So between March and late May last year, the whole world was under mobility restrictions, and a good proportion of the world's population was under lockdown measures or reduced restrictions in one way or the other. And this is in the time where we see the strongest impact as well. Secondly, in that time, the global merchandise trade, the container traffic and commercial air freight were strongly reduced. So on the side, we see a graph on freight, that's the orange line, and in the air passenger traffic. And we see that it has plummeted in the second quarter of 2020. And there was strongly reduced private air travel and tourism. And then, of course, there were lockdowns, curfews, closures in the service industry, unemployment, reduced social context and social distancing. And all of that influenced drug consumption patterns and the demand side of the drug markets. We did research, and it's very challenging, I have to say, given that drug markets are difficult to monitor. They are very inert in the sense that it is challenging to monitor developments in real time, because there's seizure data which can be monitored relatively well, but drug use, drug consumption patterns, trafficking patterns, these are all rather, it takes a long time until the data arrives at the researcher, so to say. And the information remained very scattered. Some countries had very good information, some countries not so much. It was very difficult to get very systematic or very structured data sources. So what we did is we had a call for information from member states, and we got responses by 81 countries. Then we collected information through the UNODC research network, where we had people in the field who looked at local information globally. We used reports by international organizations, and thanks a lot to EMCDDA, who had really, really good information. Obviously, we looked at peer-reviewed research, and we supplemented by anecdotal information from media reports. There remain limitations, It's still a preliminary assessment. There's a lot of data still coming in, and the situation is evolving. Just as now we see that there's a second and a third wave in Asia and in some Asian countries which are heavily affected. At the time of the research, there was comprehensive data not yet available, and the coverage remains selected. So as usual, it's very challenging to get data from some parts of the world, from others it's easier. So we focused on those countries where we could get good information, or those regions, and made an extra effort to look into developing countries. As Tim was already saying, in terms of drug production on opiates, there was hardly any disruption in 2020 or any impact. The reasons for that is that the timing of the pandemic did not affect, for example, cultivation in Afghanistan or the harvest in Afghanistan. In other countries, that would be Myanmar or Mexico, where opium is produced, the harvest has been already out in 2020 in Myanmar, or in Mexico, it's more spread out over the year, so opiate production was not strongly affected. The situation was different for coca, and here we observed disruptions in the second quarter of 2020, and these were relatively strong and had a strong impact as well on prices. And this was not so much because coca leaf, so the raw material, was not produced anymore. It was that first level traders could not go to those areas where the coca leaf is produced and the cocaine is produced then as well. Because of curfews, because of mobility restrictions, it was not possible to reach these areas, and that's why there was a disruption that led to quite a strong decrease in prices. But over the course of 2020, the situation normalized and the market recovered. Prices increased again, which was a very strong indicator, and trafficking resumed, which was possible to be seen as well in seizure data. For synthetic drugs, these are in so far different from plant-based drugs such as opiates and cocaine. It's globally, and it can be produced everywhere. Here we have seen no disruptions in Southeast Asia, which is a major producer of methamphetamines. We had ongoing production in Western Europe, and we had some disruptions in the initial stages due to lack of precursors in the Americas and in Northern Africa. Cannabis is very difficult to monitor and evaluate, but as far as we are concerned, there does not appear to have been a very strong disruption anywhere in the world. Drug trafficking and drug seizures. Drug seizures is a very difficult indicator because it can reflect both changes in law enforcement activities and changes in the market activities. But we have seen very clearly that drugs seizures slowed down in the second and third quarters of 2020. In the case of cocaine, related to those supply disruptions. In the case of heroin, potentially due to less trafficking over land or to change law enforcement activities. In many regions, the quantity seized increased then over the course of the years and remained stable in 2020 when compared to 2019. We have seen some existing drug trafficking trends that have been accelerated. So there was an increase in the use of waterways and maritime routes. There was an increase in the use of private aircraft and the concealment of drugs in perishable goods, like containers full of food. And larger shipments have been seized in many regions. And that was an interesting finding because it was not only in some region, it was really that in Asia, we've seen the trend for heroin, we have seen the trend in Europe for cocaine. There's really a trend that has been observed in many regions across many drugs that larger shipments have been seized. It's a little bit unclear on where this is coming from, but it was certainly interesting and is possibly related to the increased difficulties that some traffickers have faced in trafficking during COVID. For retail distribution, I may make that very short now, given the time, but we have gotten reports from increase in home deliveries of drugs, novel methods of drug distributions on the streets, for example, using food transports when food transports were the only allowed on the streets, or the disguised as essential workers. We heard one story where dogs were used for drug distribution because it was still allowed to go to walk your dog, basically. There was an increased or reported increased use of drones and technology-based solutions, which includes, for example, contactless distributions, which uses mobile phones and GPS locations, not necessarily the internet per se. Increased use of mail services for small-scale seizures, and a strong reduction in trafficking by air, which is obviously due to the reduced flights. The drug trade over the internet, we've heard already from EMCDDA that it's challenging to say what's exactly happening and that it still accounts for a relatively small proportion. Nevertheless, some reports found an increase in popularity, others a decrease in popularity. What we have seen was a strong expansion of the Hydra market, which caters Russian-speaking customers in the wider area, but that is not necessarily related to the pandemic. And lastly, to close, perhaps the lessons learned and the outlook. First, it was very clear that there was an initial disruption in that period of time where the whole world was under shock, so to say, and where nothing moved or where it was really difficult to get anything done. But then trafficking continued very quickly. So there was an inherent resilience and adaptation of drug markets to the COVID-19 measures. Some of the developments we have seen may have been caused by travel restrictions. And one thing would be, for example, this increased use of maritime routes. So when it was more difficult to use land routes, maritime routes were the method of choice. And these required some kind of logistics. So it may be that these are just sticking, because if they prove to be successful, maritime routes may continue being used at an increased pace. Overall, however, the observed developments have been direct reactions to the immediate impact of COVID-19. And if this immediate impact is gone, or if the lives return to normal, it has been shown that drug trafficking continued at a similar pace as before. So it's not likely that that in itself is fundamentally changing the size, the scope, and the dynamic of drug markets. The combination of these changes, however, and the global deterioration of the social and economic development, which may, with the looming economic crisis, if it comes as projected, and the ongoing difficulties in many countries, including those where drug production is going on, may, however, have long-term consequences for drug markets. Drug production, for example, of cocaine and heroin is very closely related to the lack of opportunities for development. And with the increased and the continuing pandemic in these countries, it may be the case that this leads to a deterioration of the situation, and that may lead to increased drug production and trafficking down the road as well. So this would be the say from my side. Thank you very much.
Thank you very much, Irmgard. Can I ask a couple of quick questions from me, and then we will open it up? And I see we have some questions already in the Q&A box. Thank you very much. Please type your questions in. Oh, hello. Sadly, I don't speak Spanish or read Spanish, so you will need to bear with us. Irmgard, perhaps you want to stop your screen sharing for the moment.
Trying to.
But yeah, no, that's good. It's done.
Okay, good.
It's perfect. Can I ask you the same question I asked Tim about the role of the internet and drug supply versus the retail end of the market, and what your perceptions are about that?
Yeah, I think the answer is similar. So from our view, first, the internet is large. So there's the darknet, which is very technology driven and relatively complicated and not easily accessible. Then there's methods that are using the clear net, where people are informing themselves, may come in contact with their dealers through social media, through Facebook, WhatsApp, whatnot, and then use these technologies for drug trafficking on the retail level. I think the latter one is certainly something that has increased and is certainly something that is on the rise. And we heard from countries in Central Asia and in Russia, for example, that these contactless methods are really very frequently used. And that would, or is technology enabled, but it's not the darknet as such. It's not really an order from the internet as we would order from Amazon. So I think that a little bit looking into these details may shed a little light on how drug trafficking patterns change. There's certainly potential for stronger increases, but to date, it's not making the majority of drug deals.
Okay. And a second question, which actually comes from one of our more than 500 delegates that we have listening, is in relation to the people who are the retail delivering drugs during COVID. So I also heard stories about some drug sellers dressing up as nurses and doctors so that they were allowed to move between households. The question is, do we know anything about the age of these people who are doing this retail selling during COVID?
We did not get any information on age distribution. It may be certainly very interesting to see if new people have entered drug dealing, for example. So that would be very interesting to see if there was an opportunity or due to unemployment. We've certainly seen, and that was more on the youth side, that unemployment had a strong effect and that having more time at hand had a strong effect on use patterns. And this may for sure have had an impact on drug trafficking too.
Terrific. Thank you very much, Irmgard. Unfortunately, due to technical problems, our third speaker from Iran has not been able to join us. He's an associate professor of psychiatry. His work involved a survey of psychiatrists to ask them about their perceptions of drug supply changes, but we have not been able to resolve our technical difficulties. However, both Irmgard and Tim are excellent experts to have now for our question and answer session. And if I can ask the technical people to have Tim join on the larger screen along with myself, I already have a series of questions from the many delegates who are listening. The first question from our delegates concerns cannabis. Both of you have spoken about how hard it is to monitor cannabis. We also know that cannabis is now legal in many United States of America states, as well as in Canada, as well as other nations. The question is, do you think the full legalization of cannabis globally will resolve drug trafficking? Tim, would you like to go first?
Well, I'm not so sure about that because it also depends on the location. Every situation in geolocations is different. For instance, in Canada, we have seen actually an increase in the black market since the legalization in certain parts because the legal cannabis that was for offer was of inferior quality of the one that was being offered on black markets. It was also cheaper on black markets. Of course, when you legalize, you need to have like age restrictions, you need to have taxes, and criminals don't like to pay taxes. So they will, I'm pretty sure will continue doing whatever they are doing and offer it at the, I mean, you can still buy fake cigarettes and cigarettes are legal. So I'm not convinced it will solve drug trafficking as a whole.
Okay. Irmgard, would you like to comment on cannabis legalization?
Yeah, I think I agree with Tim that cannabis legalization as such certainly has, I mean, many member states opted for it and probably have very good reasons for doing so. On a global level, I don't think that it will resolve drug trafficking as a whole. And if I may perhaps add it, that some countries, in particular in Africa, are continuously reporting that cannabis consumption is a very strong, a very high proportion of those seeking treatment are doing that for cannabis consumption. So there is a health concern that many countries are sharing, and which may very much depend on the regional and the cultural context that these drugs are consumed in. So I think it's a very challenging topic to discuss at the global level, because there may not be a one-size-fits-all solution to it.
Sure, thank you. One of our delegates has also commented on this issue of, you know, the problem of the criminalisation of drug use is the stigma, extortion, imprisonment, and all of the negative consequences. The question is about whether the regulation of illicit drugs has improved the quality of life of people. I don't know whether either of you can answer that question. I might say that the research in relation to cannabis, the research out of America, it's still a bit too early to tell about quality of life. I mean, one of the issues is that much of the production and sale of cannabis was amongst Black communities in America, and then they were banned from entering the legal market. So their economic circumstances actually declined with the legalization of cannabis, which would suggest a drop in quality of life. But in other cases, removing imprisonment has been, and moving to civil offences has been very important for people's lives around the world where drug use has been decriminalised. So you look at Portugal, Tim might want to comment on what's happened in Portugal in relation to decriminalisation, which is the removal of criminal penalties for personal use. And we have seen significant improvements in quality of life in countries that have decriminalised. So perhaps, Tim, did you want to make some comment about Portugal? Because I think that perhaps speaks to the delegates' questions about improvements in quality of life.
Yeah, well, I don't know, of course, the exact details, but first of all, what I will say now heavily draws on research done by Alex Stevens. He has actually done quite some good research on the impact of decriminalization of drugs in Portugal. I can recommend everyone to look it up. What we saw that during the 90s in Portugal, you had a serious rise of drug-related deaths in Portugal, often related to heroin use. And the government decided to entirely switch their policy and decriminalize possession of personal amounts of drugs and take it out of the penal law, well, and make it a civil misconduct. And on the other hand, if they would find that you are a problem user, the penalty would be that you are forced into treatment. So what we saw after this policy change is that the number of drug-related deaths dropped immensely because they had a better view on their problematic users. On the other hand, you saw a slight increase in cannabis use a bit earlier than everywhere else, because it's going up everywhere, of course, especially now in these days. So, well, for Portugal, at least I can say that it worked out very well. Yet again, it works in Portugal. It doesn't mean that it has to work somewhere else on the exact same way. So this is basically my comment, and I will try to find the link to the research of Alex Stevens, and I posted in the Q&A.
Thank you very much, Tim. Yes, I mean, I think it is important to remind that in relation to Portugal and many other countries, we are talking about decriminalisation of drug use, not drug supply. So drug supply remains a criminal activity, whereas drug use is treated as a health and social problem rather than a criminal justice problem. We, of course, I am always happy to talk about drug regulation, legalization, and decriminalization. But let's move to statistics on drug production. So there's a question that's come through about how do we improve our monitoring of drug supply trends. I mean, both of you have talked a little bit about the methods. The question is, are there new advances in methods for tracking trends in drug supply? And I would add a question to that I often think about is, how do we distinguish between police activity versus drug cartel and drug trafficking activity? Because most of our indicators are police activity, not actually drug trafficking activity. So seizures are police activity, et cetera, et cetera. Irmgard, do you want to go? Do you want to go first?
So perhaps to the first question on drug production, for the way it's currently done, at least from a UNODC perspective, for cocaine and for opium production, which is then the raw material for heroin, there are projects in those countries. So cocaine is produced in 3 countries in Latin America, heroin mainly coming from Afghanistan, followed by a distance from Myanmar and Mexico. And there is a combination of satellite imagery to estimate the area under cultivation, plus field visits to estimate potential yield and then potential production. And that then can be converted into a heroin and a cocaine production estimate by using conversion factors. For cannabis and for synthetic drugs, it's much more challenging because they are produced globally and are much more difficult to monitor because it's much less centralized. To the question on seizures and law enforcement activity, yes, it is very challenging, and certainly seizures are in itself a good indicator for law enforcement activity, not so much perhaps for drug trafficking. However, it gets very interesting once the data is combined with other data sources, for example, price data. If price data indicates an increase in price, can indicate a decrease in supply or an increase in demand. And if combining that with seizure information, it can help to understand the market dynamics better. So I think the key to monitor and to understand trafficking patterns based from the few data points that we have would be triangulation, and to really try to combine all the information that we have on the various ends, and then to see if we can paint a comprehensive picture on what was going on.
Thank you. Can you say a little bit more about price and purity adjusted price? Yeah. Because I think those two concepts are fundamental to a good triangulation.
Yes. That's right. So prices first of all, prices come at many levels. So there are prices at the use level, there are prices at the wholesale level, there are prices at the source for the raw materials. All of them are connected, even though it's not straightforward, and it's a long journey from the source to the destination, and in between a lot can happen. Purity comes into play because heroin, for example, can on the street level is between 2 and maximum 10% purity. At the destination, at the trafficking level, we are talking between 50 and 70% and up to 90. And the prices do correlate with purity. So the higher the purity, the higher the quality of a product, the higher the prices we can expect. And then to make them comparable, to compare that grams that are consumed in the street with the prices that are for a high quality heroin package on the trafficking level, one can purity adjust the prices and assume a purity, and purity information is unfortunately relatively scattered as well, but it's there, so it can be used. And then these prices can be purity adjusted. That is well said that we have, for example, observed that if there was a surge in production, purity increased downstream. It took a while until this happened, but there was certainly a correlation again with how much is on the market and how pure the products are. And that has implications then as well for observing the market and for interpreting the prices and interpreting this amount seized if they go up and down, because the purity in itself would be, or the purity adjusted product would be the better indicator for how much product there actually is and there actually is trafficked. So it's difficult, but it's true for understanding drug markets, a large, better to observe whatever can be observed and then try to combine the information.
Yeah, thank you very much, Irmgard. I mean, I think price and purity adjusted price and what level of the market we're talking about are sort of fundamental ideas to that part of the various drug monitoring. And we could certainly improve our methods in relation to purity adjusted price analysis at the different market levels, which would be a way of improving our monitoring, I think. So Tim, the original question, just in case you've forgotten, was how could we improve drug market monitoring into the future? And I think I added to that about the problem of whether we're talking about police activity or illegal activity.
Yes. Well, first of all, number one feature for me for drug monitoring is the timeliness of your data. And the problem is, just an example, the EU European Drug Report that was released a week ago draws on data from 2019 because it takes a lot of time to collect all the data from all the countries. And those countries need time to collect it from the law enforcement. On top of that, it's what we call the registration burden of law enforcement officers is already, I mean, it's important, these people need to be motivated to register, but it's a lot of work. So if we can, with the current technology, if we can find ways to make the registration easier and faster, so that law enforcement sees a more direct advantage, even operationally and strategically, this will solve, I think, a lot of things. That's one thing. Yes, of course, triangulation is also key. We can't just draw on law enforcement data for the thing I said before, but also, of course, because it's also a reflection of the activities of law enforcement. So you also need user data to triangulate with. Of course, the traditional surveys has its biases, but now we are getting very far in wastewater analysis, which we can actually determine the actual use of a certain population at a certain location. And if you compare this with seizure data and production data, you could more or less combine the data to see a market size estimate, to see how big the market actually is, approximately. So, and wastewater analysis, where it was initially just for detecting use, now they're advancing in detecting production as well. They're detecting side products of synthetic drug labs, predominantly. I know in the Netherlands, not a coincidence, they are very far with this already. And again, of course, the problematic issue for monitoring in the EU is indoor cannabis cultivation, especially because there are so many. It's difficult to register. You can't motivate law enforcement agencies to actually register everything very detailed. Again, in the Netherlands, they are now monitoring the electricity net to actually detect indoor cannabis cultivation sites. So that's again a different method of actually registering cannabis cultivation. But yet again, these are all possibilities to combine your law enforcement data with. But we always have a long way to go, but we'll never stop. We always want to try to improve.
Yeah. Thank you for raising wastewater analysis. I think that has been an important technological development, notwithstanding many complexities and some fear about privacy and concerns about surveillance, which often arises. And I think with wastewater, some challenges translating from the compounds found in the water to what that means for a population or for drug use. So if you detect, 100 grams of cocaine, does that mean 100 people used 1 gram? Or does it mean that one person used 100 grams? And from my point of view, so my background is public health, I don't care how many people use drugs. I worry about harmful drug use and the harms. So for me, wastewater, which can't tell me whether it's one person or 100 people, doesn't help me understand how harmful, how many harms are going on. I also think that with wastewater analysis, it is being used as a very useful monitoring tool, as well as being critiqued. I think with COVID-19, there's been an interesting faith in wastewater because of the detection of COVID fragments. Mm-hmm. So when wastewater analysis for drugs was seen as heavy surveillance, now wastewater has become a force for good in detecting COVID fragments. So here in Sydney, Australia, we're using wastewater to identify where there might be COVID because we have almost no COVID in Australia. So as soon as it's detected in the wastewater, alerts go out for the areas that service that sewerage system, and people wear masks. In countries with high rates of COVID, it would make no sense to use wastewater. But in Australia, it's actually being used extensively to support our COVID surveillance. Now, it seems that many people would like to return to the topic of the legalization and regulation of drugs, which we would be very happy to talk about. But before that, a couple of other quick questions. One, Irmgard, is in relation to the World Drug Report. Mm-hmm. Could you let us know when that is likely to be released? Perhaps June, just explain, not everyone might know what the World Drug Report is, so perhaps it's just a few words about when it's released and how does one register for the release of the report?
The report is an annual UNODC report that draws from contributions from member states, and perhaps following as well what Tim was saying. So usually the data that, we get annual responses from member states which are then 2 years old. This year we have a separate booklet on the impact of COVID-19. And for that, we really tried and made the effort to get more timely data with all its challenges. The report is each year released around the World Drug Day, which was on June 26th. This year it is a Saturday, so I think the release will be on June 24. And I will see that I find the announcement and post it into the chat then. Including as well a link to a registration of an event if there is a registration necessary. So I will see that I find that link. So that's for the World Drug Report. And for more details on the research on COVID-19 and drug markets, certainly it makes sense to look forward to this group of publication.
Wonderful. Thank you, Irmgard. I think one of your colleagues might have already posted into the chat some of those details, but usually June 26th, maybe June 24th this year. Okay. We shall return to the topic of the regulation of drugs. In particular, this issue of whether drugs are a legal law enforcement safety problem or whether drugs are a public health problem. This is a very difficult question. And I know Irmgard and Tim are often involved in these conversations about criminal justice versus public health. Which one of you would like to comment first, if at all, on this? I mean, I'm happy if you say no.
I may perhaps. I think that first the discussion is very often led, and for a very good reason, in the context of drug consumption and on the use side. Here, certainly the largest burden of both the harms and the health consequences and the stigmatization and the unavailability of treatment and the unavailability of people getting help if they need one, in contrast to being incarcerated, in contrast to having a law enforcement response, is the strongest obvious. I think the discussion can be extended then as well towards trafficking and drug production, because here it's usually not as much discussed, even though there's a very strong reason or a very strong use as well to extend this discussion, not so much in this case of treatment versus law enforcement, but perhaps rather of trying to find alternative development approaches, of trying to find ways to use the development agenda, of ways to provide people with alternatives to drug production and drug trafficking in order to avoid that people are engaging in these activities. I don't think that it's a black and white matter. I don't think that, and I think that there's a whole spectrum between complete legalization of drug markets, which would include production, trafficking, and consumption, and a complete law enforcement approach that would aim at incarceration and using the law from the very beginning to the very end. And I think the answer is certainly on a scale. And I don't think that there's a one-size-fits-all answer, because it really depends on the substance, it depends on the country, it depends on the consequences that a certain activity has on public health, but as well on security, on safety, on the rule of law, on governance, on all these aspects that are maybe much more relevant in countries where they are weak in the rule of law, or they're weak in governance, and they're weak in enforcing security to their population, rather than in countries where drug consumption is the main issue. So I think from a global perspective, there needs to be a very careful discussion, and a discussion that really involves all of these aspects and takes a lot of these topics into consideration.
Thank you very much, Irmgard. I mean, I would add, before I pass to Tim, I mean, the whole idea of whether a drug is legal or illegal is a problem. Because it is not, so there is no relationship between substances that are harmful and their legal status. So the drug that causes the most harm is alcohol and tobacco. By a long shot, whether you measure hospitalizations, whether you measure mortality or death, whether you measure economic cost, productivity in terms of employment, and so on. So alcohol and tobacco cause the most burden economically, socially, and in terms of health. those two substances are legal. And then we come to the problem of legally available substances that are misused. So pharmaceutical opioids, what is happening in relation to fentanyl, tramadol, various medications that become misused, that cause an enormous amount of death. The United States, for example, has a declining average age of mortality or years of life as a result of the opioid epidemic in the US. And these are, largely speaking, legal drugs that have, or a legal type drug, fentanyl, that has been displaced into the illicit market. And so heroin is cut with fentanyl and the user doesn't realise this. So there are these blurry, we've got alcohol and tobacco, we've got pharmaceutical opioids and other pharmaceutical products. And then we have things like cannabis, which has therapeutic effects. So we have an illegal drug that many people find medicinal uses for, in terms of managing nausea, managing pain, managing stress. There is some research showing that MDMA or ecstasy is an effective treatment for post-traumatic stress disorder. So we have, it's not just cannabis, there are other substances that are currently illegal that have been shown to have therapeutic properties, and traditional use of medicines, ayahuasca, and other types of kava in the Pacific region. So this idea that this is a simple legal, illegal is just not right. And it is very, very complicated to think about how do we, as a society and as a world, regulate both the consumption of substances, whether legal or illegal, and their production and trade. And where is the harm? Where are the harms arising in the production and trade? Irmgard's mentioned rule of law, weak and failing states. Where are the harms at the domestic or local level? So none of this is very easy. And Tim might have the answer for us.
You just said everything what I was about to say, but now I don't have much to add to this. All what I can say is that yeah, there are social cost studies that really indicate all of this, especially in Belgium. There's a famous one indicating like 92% of all social costs are inflicted by alcohol and tobacco, and only 4% by illicit drugs. Does this mean we have to legalize? Of course, there's no crystal clear answer to this. It's very complicated to figure it out. I was going to say something else, but it has slipped my mind.
I see someone has commented in the Q&A about young people and drug use, that the problem is not the drug market. The problem is, well, let me interpret this question, and you might want to comment, Tim, that the problem is not the drug market, but it's that young people are choosing to use drugs. And what does this say about our society? How could we perhaps better, what do we suggest to control this conflict in relation to young people that consume drugs?
This goes a bit the moral direction.
Sure. Always. I mean,
always.
Can I say, the study of drugs is a study of moral issues and ethics and values. Yes.
Yeah, well, it's complicated. The trends are showing like this. I remember what I was going to say again lately. There's still a large understudied area in drugs and drugs production, which is not only the social harms, but are now, which is coming up in research, the environmental harms.
Yes.
Of drugs.
Yes.
Not only drugs production, but also drug use relates to certainly to CO2 emissions, greenhouse gases, soil erosion.
The traffic miles for the air cargo, for the drug trafficking.
Exactly. Yes. If you all add it up, it's huge. And then, of course, then the question comes, yeah, but this is the case for legal substances as well. So we are still in the initial phase of researching this, but I can, yeah. I would say to everyone, look into the field. I mean, now, of course, that's the advantage of the legalized markets in the US. We get more data on it because of it. Because of the legal production sites, we see how much CO2 emissions it produces, how much water it needs. So, yeah, so there's no fit for all answer.
No,
we will keep our jobs for some time.
Indeed. Thank you, Tim. There's a couple of comments in the Q&A in relation to the role of industry and whether when you legalise, does the black market continue? And Tim, I think you mentioned earlier that the black market definitely continues. In fact, the idea that if you legalise, you eliminate the black market has been shown not to be the case. And it comes to setting the price with taxation. And there are some other comments about the drug market and industry. It is worth saying I also do research in relation to alcohol, and the for-profit industry, the legal for-profit industry is arguably as egregious as the illegal for-profit industry. And there is a problem with marketing and with promotions and with sales that encourages consumption. And if we are concerned about young people and we feel that a lot of drug use is harmful or some drug use is harmful, then we want to discourage consumption. And legalization of currently illegal drugs and placing them in the hands of the for-profit industry will absolutely see consumption increase, as is the case with alcohol and tobacco. So the role of, so how an illegal industry works, and I think we understand there were major disruptions during COVID, but the illegal industry bounced back. I think you could say that is exactly the same for legal industries. Also, major disruptions during COVID also have bounced back. I think we will finish the session unless there is any final comment that Tim or Irmgard you would like to make. We have covered, I mean, we started with what's happened during COVID and drug trafficking, and we've ended up with a debate about public health and legalization and regulation of drugs, which I am absolutely delighted to hear that this is where we have ended up. But we've covered a lot of terrain. Irmgard, are there any closing words?
Yes, I may, coming from a data person, I may want to make here a very strong call for trying to reduce the moral and increase the evidence base of the discussion. I fully agree. As soon as you discuss drugs, you discuss morale, you discuss values, you discuss different cultural aspects that may not be measurable or should not be measured. But in any case, I think the more we know and the better we understand the phenomenon, we better understand what the consequence of a certain economic activity is, be it drug use, be it drug trafficking, be it legal drugs, be it illegal drugs. The better we understand the phenomenon and the less we reduce the discussion to gut feelings and to opinions, be it either on the very strict response or on the very liberal response, I think the better we can have such a discussion and the better we can find a international consensus on topics that are certainly, from an international perspective, very polarized, because the spectrum of what the right response to the drug issue is a very, very, very broad one, globally speaking. And to find such a consensus is, in a democratic system, very difficult. And I think that one of the most important things to facilitate such a process is better data and is a better understanding of what we are talking about. So in a very UN-like general closing remark, I would want to really emphasize that good impartial information is really key for having such a discussion on an international level.
Thank you very much, Irmgard. A call for evidence and science and more and better data to inform drug policy. Tim.
Yeah, exactly. I mean, I can only conclude by saying what we all want is to reduce the harms of drugs, not only to users directly, but also that people are harmed by drug production or being forced into drug trafficking or are being smuggled by criminal organizations who use them into drugs production process or anything else. So in the end, we all want the same. We want to be the harm of drugs to be as low as possible. And for that, we need, as Irmgard says, data. And I think our mission is to optimize the data stream in the new era, digitalize it, make it faster. I mean, the faster we get the data, the faster we can inform policymakers and the faster we can act to it. So this is a call to just stop filling in papers, sending them in an envelope to an office who has to send the envelope to another office who has sent the envelope to the UNODC or to the EMCDDA. Let's try to step into the new era and improve our data digitally. That's it.
Thank you so much. Can, on behalf of the more than 500 people who have joined us for this session, I'm sorry that you can't hear the applause, but I know it is there. Thank you so much, Tim and Irmgard. Can I also please thank the UNODC for supporting this session and the team in Mexico who have done an outstanding job pulling this conference together. Thank you all very, very much. Let me hand back to the coordinators. Thank you.
Thank you very much, Alison, for your delightful moderation and for our two panelists for the enriching and interesting conversation on how to improve our knowledge on drugs and drug monitoring. Thank you, colleagues, for closing our third day of conference with such a pivotal topic. Thank you so much. Hemos cerrado el